Hi everyone, welcome back to another podcast of our Illuminating Primary Care. This is your go-to podcast for obviously our UK trained GPs. Now, for those of you that don't know who I am, my name's Thomas. I run our international division here at Menlo Park and have helped countless individuals just like you transition successfully overseas. I've been doing this for about 5 or 6 years now, and really keen to make sure we're able to help you throughout this journey. It's a big move, no matter where it is that you decide to go, and therefore we want to obviously make sure we're making this right. Now, today's episode is going to be all about Canada and what working as a GP in Canada could be like for you. We'll discuss obviously what makes the healthcare system so attractive. We're going to go through the billing systems, the earnings, run through the work-life balance, and also just kind of run through a little bit around what opportunities are available right now for UK GPs. So if you haven't already, make sure you subscribe, follow us on LinkedIn, Facebook, and Spotify and YouTube. And there's plenty more episodes of this that are in the making, diving into different topics in more detail and just trying to really just provide you with the information that you need to make this decision. So I guess to start off with, as many of you know, the NHS is facing massive strain. This is obviously causing a lot of their UK GPs to explore their options and many to where to think about moving overseas. This, I guess, comes down to a few key things of understaffing, underfunding. There is an endless backlog. There's the infrastructure, obviously within the NHS and within the practices, unfortunately, is not obviously what people are looking for. And I guess really GPs are really trying to kind of look for a better earning ability. Obviously have this ability of feeling valued, making sure they're actually feeling appreciated and wanting to obviously enhance their career, not finding themselves working all hours of the day with a poor work-life balance. They want to enjoy their life, and obviously they feel like something better is out there, something greener is out there, and truth be told, it is. Unfortunately, I guess the people ask me this all the time. What is the catch? The catch is you've got to jump on a plane and obviously move overseas. Now, as you can imagine, I see many GPs frustrated with the system here in the UK. Obviously, it's not delivering the care obviously that they felt like they trained so many years for, and therefore they're feeling stuck. Obviously, GPs are the front line of our healthcare, and obviously, salaries sadly not being where they should be. Job satisfaction being low, burnout obviously being common. We want to make sure that we've been able to obviously really address your concerns and make this obviously a rewarding career that you really kind of set out to achieve. Which I guess obviously is leading us on to it's not being surprising for GPs to want to make this move. It's not just about obviously the paycheck, as I say, it is about obviously that respect and that career fulfillment. Now, I guess obviously a lot of people are probably wondering, how does the Canadian healthcare system differ from the UK? And Canada has a publicly funded healthcare system called Medicare. Now, this is available for everybody within the country, but it's actually managed individually by its own province or territory. You'll find that it's known, obviously, for its universal access to high caliber care. Obviously, very patient centered and focused on the community well-being. As a GP over in Canada, you are the backbone of the system, and this is not just a referral machine, like obviously some people have described the NHS. Your role is physically respected. It's valued. You are surrounded by the support that you want and that you need. It really is about providing true care, not just firefighting, but actually delivering. You find that you're seen obviously as a leader within the community. GPs are genuinely respected, is an old school level of respect over in Canada, which I personally have witnessed and love, and you genuinely will be valued for your work. A lot of people obviously ask me, what does it actually look like for a GP working on the ground? And I guess the main thing to say is that GPs typically are working between 38 and 40 hours a week. When you finish, you genuinely finish. This is not a case of, going off and doing a 10 plus hours worth of admin or staying late. You actually walk out the door and go home. Your time off is truly yours. You'll be able to find yourself obviously finishing your day, not thinking about obviously work, going off obviously and enjoying obviously the lifestyle that Canada has to offer, depending on obviously where you are. There's a few different types of settings over in Canada, whether it's a group clinic that we're looking at, which is owned by a bit more of a corporate kind of group, or even some of the smaller groups. We've got private practices. Let's say you and I, we owned a medical centre, or a husband and wife owned practice, and there's also community health centres. So no matter what it is that you're looking for, Canada has it, and we can obviously facilitate making sure we find a practice that's right for you. Now, you can even specialize over in Canada and be rewarded. Okay. Unlike the UK, where quite often I find that people are trying to enhance their specialities just to try and obviously give more variety into their day. What you'll find in Canada is that you're actually earning for the work you put in. Okay, things like obviously pediatrics, minor surgery, kind of geriatrics, women's health. These are all things that you can obviously offer. You can break up your day. You can plan your day obviously around being able to obviously see specific patients, so that you can make sure you're providing obviously the care that you want, and obviously in the areas where you want to as well. So you find that obviously it's a huge shift from what GPs are currently doing here in the NHS, which is great. You're not in this frigid framework. You've actually found that you've got this room to grow, which obviously from speaking to so many of you, I know this is something that you are all looking for. Now, money. I know it's not all about money, but money does make this world go round. You'll find that with this system in Canada, it's a fee per service model. So you actually bill for what you do. And this is kind of what I was meaning when we're talking about those specialities and enhancing your skills. The more services that you're offering, the more hours that you do, the more patients that you see, the more money you'll make. Okay, it's as simple as that. It's a fee per service model. You bill for what you do, you charge your worth, and you get paid your value. Okay. Now, some practices will offer a set salary. This can be nice, obviously, for stability. It's not as common, but either way, I do tend to find that GPs are earning significant in comparison to where the earnings here in the UK. I've seen GPs very, very comfortably earn anywhere from 300,000 Canadian dollars all the way up to 600,000 Canadian dollars. It depends on obviously on where they're working on the province. So it depends on the location. It also depends on how many hours that they're doing. If you're working part-time to full-time, there's going to be obviously quite a difference, there. And again, obviously those services that you're offering, depending on obviously what you're billing and what you're charging for those services, obviously will demand on the earning ability as well. But as I say, the earnings can vary quite drastically, and this is something that we can go into in more detail together to obviously try and align obviously what your potential earning could be. Just bear in mind, obviously, when we are thinking about this, obviously the higher percentage that you'd be taking, because you take a percentage of billings. Okay, the billings are split between you and the practice. You pay the practice a percentage, okay, and that's to cover the cost of the practice, the admin staff, the nurses, receptionists, practice management, pay the actual bills within the practice, and this is obviously the way that setup is. It's more like a partnership model. So if you think about the way that a locum is set up, where obviously you've set your limited company working in the background, that's very similar to the way the system is over in Canada. You will find that you are obviously trading under the banner of the practice, but you will be running your own business, obviously, in the background. So the higher the percentage that you agree with the practice does not mean the higher the take home. I typically would see percentages vary somewhere between about 60 to kind of 80%. And it's worth noting that the highest GP that I've placed over in Canada is actually on 70%. They were in a very, very busy practice, a thriving practice, a huge range of different skills. And therefore being in the right practice at 70% in a busy practice allowed him to make more money than working in a quiet practice on 80%. As I say, it does depend on the patient demand, the working hours that you're doing, and obviously the locations. All of this will play a pivotal role. Now, you're probably thinking, okay, Canada, what's it like being in Canada? What is it like obviously outside of the clinic? And now, Canada is huge. Whether you're looking for the city buzz, somewhere like Toronto or Vancouver, or you're thinking of maybe a more relaxed place, maybe like Nova Scotia, there's a lifestyle for everybody, and this is something that we can dive into and go into. I'm very, very keen about making sure we find an area that aligns to your wants and your needs, along with the practice. I think both of them personally are important. And obviously, from my experience, making sure you're in the right area with the right practice is crucial. So we will make sure that we're diving into this and going into the detail with you in more in future conversations to have. Now, Canada's obviously diverse. You've got obviously a range of different big cities like Toronto, Vancouver. As we say, these are very buzzing. These are very multicultural. But you've also got laid back coastal communities. If that's what you're looking for, there's peaceful, rural, quieter towns. If that's what you're looking for as well. Now, we're not talking rural as in hours and hours away, unless that's what you want. We could just be looking at a couple of hours out of the major city and giving you that best of both worlds. Now, wherever it is that you choose, Canada does have a high standard of living. It's got the beautiful scenery. I know that's what appeals to an awful lot of people. It's got obviously world-class public and healthcare systems. It provides that work-life balance, and it really is a beautiful and a clean place. So it's not just about the money. It is about obviously that better life, not just for you, but obviously potentially also for your family as well. So no matter where you live, constantly Canada ranks incredibly high for its quality of life. Check the quality of life index, you'll find it ranks much higher than the UK. And wherever it is you go in these areas, obviously the cost of living will vary. You will find obviously places like Toronto, places like Vancouver are certainly more expensive than other places. Especially obviously from a housing perspective. But obviously, if you look on the outskirts, that can be more cost effective. Just like thinking about living in the centre of London. If you want to live in the centre of London, it's a lot more expensive than living on the outskirts of London, as you can imagine. So we can try and dive into obviously this in a bit more detail around obviously what could be more affordable options for you, still providing a great quality of life. But do bear in mind obviously as a GP in Canada or a family physician as they call them, you will be in that top percentage of earners. So affordability really won't be something to worry about as you start obviously billing and earning very comfortably. Now, from an immigration perspective, this is something that we will assist you with. We do try and provide obviously guidance, not just through the registration process to make this move happen, but we'll actually assist you with the immigration side of things. I need to stress I'm no visa agent, but obviously have helped so many of you GPs move and individuals move obviously into Canada that I'm very, very comfortable obviously to try and assist you and guide you through this. And from a registration perspective, I've quite literally set up a step-by-step guide. Okay, so trying to make life as simple as possible for this transition for you. I want to make sure that we're being able to make this clear rather than it being obviously a confusing and a daunting process. I want to make sure that we're making this as simple and as clear as possible for yourselves. Now, there's a few different things obviously to bear in mind obviously when we are going through this process, things such as age, the experience, languages, things obviously to be taken into consideration when we're looking at the visas. When we're thinking about the registration perspective, if you're a UK trained GP, here in the UK or in the NHS, not a problem. We'll assist you obviously, and we'll make sure that obviously you're setting up with the relevant province, depending on obviously where it is that you want to go. So to give you a bit of a breakdown, what we tend to find is that we will make a start on the registration. We'll then look into obviously gaining interviews and a job offer. We'll secure obviously the job offer and apply for the relevant province, and then start applying obviously for the visas, making sure that everything is set up correctly to obviously make this move. As I say, get in touch obviously, and I'm more than happy to kind of go through this registration and this process. We can build timelines together, just to kind of hold ourselves accountable and move forward smoothly together from there. And I'm sure many of you are probably thinking, okay, Thomas, you've been doing this for a little while. You say you've obviously helped people make this transition. So what do they say? What are they saying about making the move? And you'll be really interested to know that one of the most common things I've heard, especially more recently, is people that looked into this move 4 or 5 years ago, that have moved over the past year or 2 years, that advised me that they wish they'd done it sooner. They were waiting and hoping that the NHS was going to get better. They were telling me that things can't get any worse. Unfortunately, they have. So they wish they'd moved sooner. They have also advised me that they feel truly appreciated and respected for the work, obviously, that they're doing, that they're able to spend more time with the kids, that their work doesn't feel like that's what they're living for. It's not taking over their life. They're actually able to enjoy, their lifestyle. And one the other week actually advised me they said they felt like they were a doctor again, and that was so warming to hear. I think it's really, really important that we do and that you do prioritize not just obviously your career, but also obviously your life. There's so much obviously that we only live once. There's so much obviously that we need to do in that period of time, and therefore obviously we'll really want to make sure that you're thinking about the number one being you. You'll find obviously that GPs that do make this move, most of them don't return. You will find obviously that they find everything that they are looking for in Canada, and therefore they don't think about coming home. If obviously it was a case that you did want to obviously keep on coming home, or you wanted to obviously kind of maintain your license in the UK, then that is something that you can do. You will need to obviously make sure you are revalidating with the GMC upon your return, and just come back to the UK just to obviously do kind of annual appraisals and a little bit of work. But again, this is something that we can kind of dive into there with you. So I thought I'd maybe try and highlight some of the top kind of questions that I tend to find. And I guess obviously with some of this, the top questions really are around, are the earnings real? And the answer to that is yes. I am not here to kind of, lie or to kind of, sell you something. I'm here to really get satisfaction out of obviously you being happy with the move, doing the right thing by you. And for that reason, I'm honest, I'm transparent. You'll see that I gave a range, obviously, from the earning abilities, and that range is because it depends also on you. As I say, the more that you do, the more you'll get paid. So let's have a conversation. Let's go into obviously some more detail on the on yourself, and obviously let's align the earnings and expected real earning ability based on obviously what you could be looking at in that area. Another question I get asked an awful lot is about the admin, and is the admin still a burnout? And the answer to this is no. You're in control. The admin is typically built into the consultation, and you can schedule your time around it. So you're in charge of your diary. Nobody is telling you what you need to do. You will find that you are in sole control and sole autonomy, which obviously will work out really nice for you from that perspective. Another question is, what if I don't like the area or the practice? Now, this doesn't happen very often. I do like to make sure that we are being incredibly thorough. But just like here in the UK, that can happen. And obviously, you can move. Nobody is going to be tying you into the practice. You will find, obviously, visa may have some restrictions, but nobody is quite literally, handcuffing you to the wall in the practice. You can move. We want to make sure it's going to be the right fit. We want to make sure that the area and the practice are going to be right from day one. But if that is not the case, we can obviously be transparent with the practice, get back in touch with us, and we'll liaise and get something set up in a different practice or a different area if required. Another question is the interview process and what the interview process is normally like. Typically, what we find with our clients is that they are interviewing you to make sure that it's going to be a comfortable fit, to make sure it's going to be a good fit. It's more about cultural rather than physically finding out whether you can do the job. they know the UK standards. They know that obviously this is not something where you're not capable or you don't understand what you're doing. They are very much aware that as a UK trained GP, you're classed and seen amongst the highest caliber GPs in the globe. And therefore, it's more a case of making sure that you're a good cultural fit rather than anything else. So it'll just be more of an open conversation, just obviously finding out more about you, your opportunity to find out more about them, and obviously the practice. Discuss maybe what the average day would look like, and really just obviously how the practice could work for you, how you could obviously enhance your skills, whilst being there. I tend to obviously get asked, obviously, could I speak to the practice or can I speak to a GP that's already there? And obviously, yes, you will speak to the practice whilst having the interview. Depending on the practice itself, some of these practices could be GP owned, so you'll be speaking to a GP obviously at that point. If it is obviously, for example, a group, we can certainly align it so that you can speak to obviously a GP that works in the practice as well. Quite often, obviously, it's nice to actually get to and hear from somebody that works in the practice. If it is a group, rather than just obviously speaking to a recruitment manager, for example, just obviously gives you a first-hand indication and first-hand honest opinion. So yes, we can certainly obviously align that for you. Another question that I get asked is around the processing times. Now, there's a lot of stigma around this, and I think the real reason there's a lot of stigma around this is because UGPs here in the UK are busy, and if it takes a week to get back to, if questions are asked about the registration, it takes you a week to then obviously respond. That's going to obviously add a week onto the registration. If we're looking obviously being longer, again, that's going to be longer. So what we'll be finding is that realistically through the process on the registration front, that we'll be taking somewhere between about 4 to kind of 6 months from start to finish. And that's obviously actually including securing a job. Okay, so that's obviously coming through myself. We'll assist you with, as I say, discussing the locations, running through obviously areas, housing, schooling, discussing obviously with your partner to make sure obviously it works obviously for both of you. We'll go through obviously the jobs, aligning obviously the jobs with your wants and your needs as well, and making sure you've got a clear understanding on obviously the company, but also obviously working as a GP. We'll obviously then assist you with the registration front, giving you obviously guidance through the whole steps and the visa, and making sure obviously that the move into Canada is as smooth as possible. So as I say, realistically, somewhere between about 4 and 6 months is what I'd initially be So I guess obviously from here, I guess that is giving you a short but brief, obviously, overview of what working in Canada could be like for you. As you can probably imagine, I could certainly go on about this topic for hours and hours. So if any of you would like to find out more, please do reach out to me. I know my details will be provided obviously on the bottom of this screen, but do please reach out. Happy to obviously have a conversation. No obligations whatsoever, even if it's just questions that you've got or just need some assistance with the registration front, please do feel free to obviously reach out to me. As I say, Canada is incredible. It truly offers something special for all, and a system that really respects its doctors, rewards obviously the work you put in and the hard work and the efforts obviously that you have, and really allows you to live your life that you've trained so hard for. So do please, if you are interested in finding out more, get in touch with me on the details below, and please do stay tuned for future episodes. I've already got one that's been planned, obviously running through some specific areas in Canada, what it could be like obviously to live in those areas, and I've got another one which is on the horizon with a UK GP that's made the transition into Canada, which I think obviously would be a really good insight for you as well. So please do stay tuned and keep your eyes peeled. Obviously, please have a look and listen to our previous podcasts as well. And I will look forward to speaking with you all very, very soon. Again, thank you very much for tuning in. Please subscribe, leave obviously comments and reviews. Follow us obviously on the socials if you're not already. Like I say, I look forward to working with you and hearing from some of you very, very soon. So that's it from me. Until next time, take care.